And what is AN-ACC and how is that different from the current ACFI model?
So this is a really good example of something that came out of the Royal Commission. The Aged Care Funding Instrument or ACFI has been the model that has been used to calculate the funding that an aged care provider receives for a given resident based on the level of care that that resident receives. Under ACFI, you would, if you wanted to enter aged care, you'd have an aged care assessment done on you, and then when you enter the facility, you'd have to have a member of the nursing staff would do a full assessment of you, and you would be categorised in your level of care through all of that process, and that would determine what the aged care provider was going to give you in terms of that care. However, that model was built in a different time. It was 10, 12 years old now, and as we talked about earlier, expectations have changed. The community has different expectations. Residents entering aged care have different expectations. And what AN-ACC is about doing is reflecting one of those core tenets of the aged care reforms, which is to put the resident at the centre of that care. So AN-ACC is a new way of categorising and looking at the care that needs to be delivered and then measuring it. And from a provider's perspective, then delivering funding from the government based on that care.